Welcome back. You're watching Healthy Living on Dove Television, and today we're looking at the topic infertility. And just before we went on the break, we're meant to understand that this is a situation that does not just affect the woman alone. It is something that a couple should think along together. Okay, it's not for the man, it's not for the woman, but for the couple together. And in the studio we have Dr. Olaomo Noah Oluwafemi. He's a gynecologist and with the Redeemer's Health Center, and also a consultant obstetrician. Thank you so much, sir, for staying with us on Healthy Living.
Thank you.
So at this time, our phone line is open. Please feel free to join the conversation by calling the numbers that will be displayed on your TV screen or send an SMS to us. Before we went on the break, sir, now we know that, yes, fertility, this is what some couple go through, you know, finding the difficulty to get pregnant, and having tried all of the things like self-examination, visit their gynecologists, eat the right food, ensure that they are having a good lifestyle. Let's look at other options available in managing infertility, just so there might just be a way out. I know that there are people who have tried IVF. You know, what's your take on that? What exactly is even IVF, and how would you advise people to actually try that? So
before we talk extensively on IVF, I also want to emphasize that it's not only fertility problem that will later result in IVF and adoption. Okay. That's why I'm also emphasizing that couples facing challenges with infertility should see the gynecologist on time. There are some, like we talk about hyperprolactinemia, that was the only thing that needed to be treated. Hyper what? The one when they're having breast milk coming, and they're not pregnant, they're not breastfeeding, and water and milk is coming from their breast. There have been several of my patients that was the only thing I needed to treat, and they conceived. There are other instances that they just needed to remove the fibroid, nodules disturbing them. I have patients like that after fibroid surgery, they conceive. And there are some, it's not all low sperm count that are quite bad. Some can be helped. There are some men that when they are supported and treated, they also conceive. And these are cheaper alternatives to going for IVF. But after we have seen your gynecologist and all these initial steps have been taken and are still challenged, then you move on to the next step, which, what broadly speaking, we refer them to assisted reproductive techniques, ART, IVF. Now, you see, I want to address, people have different perspectives for and against this modern intervention. And I want people to realize that babies born through IVF procedures are perfectly normal. They are intelligent, there's nothing wrong with them. There are even a lot of babies you see around that have been born through IVF, and you don't know unless they tell you, you will not know. There's nothing specially abnormal about them. They're perfectly normal. Now, and it's also very important for women to seek help on time, because the most important factor in fertility potential for a woman is the age. Okay. Now, when you have infertility and you've been there for years, 3-5 years, basic interventions have been done and there is no consent, you should go to see your gynecologist who will properly counsel and advise for IVF procedures. What this entails is the sperm will be taken from the husband, the egg from the woman, and they will be fertilized externally. And then the baby will be reimplanted into the woman to grow normally like a normal baby. It's a perfectly normal procedure. All right, please let me just take this very first caller, sir, before we continue. We have a caller. Hello, thank you so much for joining us live on Healthy Living.
Hello.
Hello, morning to you, ma. What's your name?
My name is Mercy, calling from Port Harcourt.
Okay, Mercy, please go ahead. Thank you so much for joining us.
Okay, I'll talk the question. You didn't see your period for 3 months, and when it comes out with so much pain. What should be the advice? Should I see a doctor, or is it something that just probably happened? Like, I don't know. I just called because the topic was based on infertility, and I'm really concerned.
Okay. Thank you so much, Mercy, for calling in.
All right. If your menses have been absent for about 3 months, many things could be responsible. For a young woman who is sexually active and married, pregnancy is the first thing we rule out. Because bleeding resuming after 3 months could also be some complication with pregnancy. But if this has been a recurring challenge, absent menses, irregular menses, she needs to see a gynecologist. There are several other things that could be responsible that can have impact on her fertility or otherwise. So I would advise Mercy to try and see a gynecologist for proper assessment and review and management. But don't be scared. It's not an uncommon challenge, and it's treatable.
It's not really an uncommon challenge, you know. I was going to ask Mercy if she's married and if she's an adult, because I remember many years ago while I was still in secondary school, I guess I was like maybe 15 or 14. No. I started my menstruation at 13, I think, you know, and around 14, something happened that all of a sudden I didn't see my menstruation for like 2 months or so. And I was like, what's going on? I told my mom, and be like, you know how people can be like, no, she can't be pregnant, you know. I was like, of course I cannot be. But later on, I was told that it's almost a normal thing, you know, for it to start, probably stop at that early stage when you're just starting your menstruation, and then continue to be normal. And ever since, it's been normal by God's grace. All right, sir, so we are looking at, okay, that the IVF children are normal children like every other person. So when do you advise for an adoption for a couple that have been waiting on the Lord? So at what point do you advise for adoption? Is it really a good advice?
Though, yes, it's a good advice. Though traditionally we have informal system of adoption. I know those of us, the way we grew up, we always have cousins, distant family living together. But because economic challenges, everybody have migrated from that kind of setting. Is already disrupted. Because in those days, people that have infertility usually don't even need to seek for formal adoption. They already have cousins already given to them, living with them. Now, adoption is a very viable option and alternative for couples who are well predisposed to it. But I would just advise them to go through it legally, through the proper procedure, to avoid medical legal issues with that. And for those who are not so well predisposed to adoption, there are also other options of IVF, like something we call surrogacy.
Yeah, okay.
The woman does not have to be the one to carry the baby. It's still a baby. Another woman legally carries the baby for they sign a contract. Even there are some women that is their eggs, their husband's sperm, but for some medical condition, they are not in the best state to carry the pregnancy. Maybe their womb has been damaged one way or the other, or they have some medical condition making them have repeated miscarriages. So another woman who's like a vehicle, carry the pregnancy. At delivery, they take their baby and go. So
honestly, it can just be God. I've seen a case like that. So I think it was on YouTube. I don't know where I saw that story, where a lady had to carry a pregnancy for someone who actually contracted her, and bills settled and all of that. And later on, just when the child was growing and doing well, I think around 5 years, the lady came back and said, that's my child. And that's another topic for another day.
That means they didn't do the legal framework well. There are legal framework to prevent this. And usually, most things what they do after delivery, immediately, they separate the baby from the mother to avoid the unnecessary bonding. But there are legal framework, lawyers will be involved to have. And once proper legal paperwork are signed, she will have no point.
All right. So apart from